Hello, everyone. The intent of my presentation is a motivational perspective of why you should consider starting a cash based physical therapy practice. The content is from the perspective of a physical therapist practicing in Canada. Those of you practicing outside Canada may find some bits and pieces of this to be relevant, but overall, it should apply to all those who depend primarily on sources of third party funding as their main stream of reimbursement. If you're good, you must be expensive, right? I want to introduce this concept of the value agenda, where the focus is shifting from just volume and profitability of services to the patient outcomes achieved. So, when the value agenda gains momentum, it means there is going to be an enhanced look into the patient outcomes achieved and the amount of reimbursement attached to those outcomes, rather than just a flat fee. It is true that high volume can keep you busy. However, it's the quality of services you deliver that makes you efficient. Ultimately, isn't it efficiency that determines your profitability? Improved patient outcomes in lesser visits? It just means increased profit. Attempt to educate the patient regarding achieving probably better outcomes with just fewer visits. On a per visit basis, it may mean more money, it may be more expensive, but the added convenience, it does come with a price. Help the patients realize their own potential to play an active role in their recovery. Who determines your value? Is it the insurance company or is it the outcomes that you achieve? I would suggest market yourself to the patient. You're not blowing your own trumpet by doing that. You're just informing them how best you can benefit them. They will appreciate that added information. Ultimately, assure them that in the end, they are the ones who choose. No pressure. Have you ever thought why over the counter medications are most often not covered by insurance plans? The answer is simple: it is easily accessible, highly utilized, and often the most effective first line of therapy. So just because your insurance doesn't cover it, does it mean you don't need it or you should not consider paying for it? And it's the same philosophy for physical therapy treatments. The focus or the main concern is not about whether the insurance company covers them or not, but if the patient needs it and if you can deliver the outcomes, they pay for it. The insurance that covers them is an added benefit. Something else to very carefully consider is, who does your patient come to see? Do they come to see you, or are they just coming out to check out the place that their insurance company asked them to go to or their doctor asked them to go to? What are the challenges in setting up a cash based practice? And what are some of the traits seen by those who've been successful in doing it? I like this quote from the late champion Muhammad Ali. He said, "It's lack of faith that makes people afraid of meeting challenges. I just believed in myself." Perception is the major challenge. From the patient's perspective, they have difficulty to understand why you can't work with their insurance company. From your peer group's perspective, they wonder, why do you have to set out on your own? Isn't it more expensive? Isn't it more difficult? And last, but probably The worst challenge is one's own perspective and doubts. The lack of faith in yourself that you can deliver the results and patient outcomes. A message that sells slowly but successfully is that quality is never cheap, but to invest in it, it's a result of your own determination. So the physical therapist has to make a determination that he or she will provide the best care, and the patient has to choose if they want to be too concerned about reimbursement or if they want to go to somebody who would deliver the results, but they might have to just pay up front. The next question is, are you ready to prove your value to patients and healthcare? Which means market your outcomes. They are validated, verified, and quantifiable. Electronic tools like photo are great tools. A few things to consider. Are you offering the best a physical therapist has to offer? Or are you just another healthcare personnel the patient meets in his or her journey before they end up back with a referral source? Does your patient see you as a valuable resource and a partner in their informed decision making process? Do they ever reach out to you, informing you regarding the outcome of the decision they made with your help? Or do they disappear from your office after 10 or 15 visits and you see them next only if their physician refers them back to you? That's the worst that can happen. Have you ever made a self evaluation of yourself and what's the value of your services? Are you selling your services at its value or is someone else determining your value and its price? Who reaps the profit? Your employer, the insurance company, or is it you? It's always a teamwork, and that's important to remember. Never underestimate the support you can get from your team, including the non clinical staff. They have an exceptional ability to enhance quality of care which patients can perceive or feel. Tell them that you value it and watch them perform with a passion. I like this quote from Ada Wells, who herself has successfully set up a cash based practice. Preparation, research, and assembling the proper team can help clinicians expand their practices and move towards offering a cash based service. Credential creep is another term that I want to introduce here. Now, in the end, if the consumer does not see value in your services, present standards of higher education, like entry level doctorates and post professional doctorates, will be soon seen as a credential creep or a degree inflation. A study conducted by Brown et al. In Canada mentions that there are limited outcomes that differentiate masters and doctorally prepared graduates. There is variations in educational credentials and clinical practices. It's a reality which we have to be aware about. Physical therapist Tara Jumenal, in her delivery of the 22nd John Malley lecture, sent this message to the profession. The greatest challenge to the value of physical therapy is unwarranted variation. Situations in which there are wide variations of care which is just not explained. Therefore, it's all the more necessary to provide the patient, who is the end consumer, with most satisfactory outcomes. Now, it's the time to assess how motivated are you. Please copy and paste this link to your browser to take a self assessment questionnaire. Once you fill it up, it'll give you a score interpretation which you could use as a self reflection. A narrative about your strengths and weaknesses, what you need to work on, and what you need to change if you really want to set out on your own. These are the references, and thank you.